Hi everyone, this is Dr. Disney here to review ankle palpations. So we're going to start first on the lateral aspect of the foot. You can find the lateral malleoli really easily here. And then you're going to move anterior and medial, kind of at a 45-degree angle. You should start to feel that anterior talofibular ligament. So again, moving from lateral malleoli to the talus. You're going to feel that nice thick band. That's your anterior talofibular ligament. Okay. Now, if you follow all the way down the fibula to the lateral malleoli and drop directly off of the lateral malleoli, purely inferior, you're going to feel a really taut, ropey band here. That's going to be the calcaneofibular ligament. Now, posterior talofibular ligament, which is not part of your palpations, is going to be sitting a little bit more posterior. But you can see how it all fans out really nicely here. So again, anterior talofibular sitting anterior and medial to the lateral malleoli. It's going to be more of like a broad, flat band. I would think of it more like your MCL of the knee. It's not as ropey compared to your calcaneofibular ligament. You also need to know how to tension these ligaments to confirm that you're on them. So anterior talofibular ligament, you'll put one finger on that ligament and you'll tension it with plantar flexion and inversion. Okay? We all know that's the most common ligament to be injured with ankle sprains. For the calcaneofibular ligament here, we need to get the foot in a more neutral position, and then we just purely invert the calcaneus. You want to have one finger over that ligament as you're palpating it to confirm that you're on it. But that's going to be the difference. Calcaneofibular ligament is in neutral with just pure inversion. Anterior talofibular ligament is going to be plantar flexion and inversion to tension that. While we're on the lateral aspect of the foot, I'm going to have you find the base of the fifth met. So if you go to the pinky toe, follow all the way down until you feel this bony prominence. And what's going to happen is it's going to kind of jut out towards you. So all of a sudden you're running your finger down the lateral aspect of that fifth met, and you feel a couple inches down from the pinky toe, you feel that prominence there. That's going to be the base of the fifth met. Now you can confirm that by contracting your peroneals. Right? We know peroneus brevis attaches that, so you can resist peroneus brevis function to confirm that muscle attachment at the base of the fifth. Now I'm going to have you go ahead and hold so we can take a look at your ankle here. And we want to be able to find the neck of the talus. Okay, make sure you're comfortable finding the neck of the talus because we're going to need to do this to find neutral in almost all of your ankle palpations later. So go ahead and just actively raise your foot up. You can see anterior tibialis and you can see the long toe extensors. You want to put your finger on either side of that, okay, and then have your patient relax. Go ahead and relax your foot. Now, what I want to feel is I'm going to evert, just passively evert and invert the foot, and that's how you're feeling the neck of the talus. It's on either side. We'll say medial to the anterior tibialis, lateral to the long toe extensors. And as you evert the foot, the medial neck of the talus will become more prominent. As you invert the foot, you should feel the lateral neck of the talus become more prominent. We're going to work on finding the subtalar neutral later in class, but again, be confident palpating the neck of the talus on either side. The dome of the talus is sitting right in between here. So we've got this concave distal tib fib, and then we have a convex dome of the talus. So the dome is going to be harder to palpate here unless they're in full plantar flexion. What we want to palpate is the lateral side on the neck of the talus and the medial side on the neck of the talus. And then we've also got the dorsal pedis artery. So if you can have your patient pull up all of their toes again, you can see extensor hallucis longus, and you want to go right where kind of the apex of the arch of the foot is. Go lateral to that extensor hallucis longus. Have your patient relax. And you're just waiting for a pulse. And I feel a nice strong pulse here. Right there is his pulse. I like to use a few fingers to initially palpate until I can feel it, and then I'll replace it with just that one finger. From there, I also want you to be able to palpate the sinus tarsi. If we go back to where that anterior talofibular ligament is, the sinus tarsi is just inferior to that anterior talofibular ligament. And your finger kind of sinks into this divot. As you evert, it kind of closes down that area. It makes it a little bit harder to palpate, but the tunnel gets a little bit deeper. As you invert, the anterior talofibular ligament almost covers part of that sinus tarsi, and again, it makes it a little harder to palpate. So you want them close to a neutral position, and you're feeling for this little hole or sinus that your finger can sink into. So that's going to be the sinus tarsi, just inferior to the anterior talofibular ligament. Okay. And then lastly, we're going to move to the medial side. And we want to be here on the medial side of the foot. We're looking for the navicular. So you can see the medial malleoli. You're going to be inferior and slightly distal to that medial malleoli. You can also do it a couple different ways. So like I said, move inferior and distal to the medial malleoli. You're looking for a bony prominence here. We know the posterior tibialis attaches there, so I could also resist plantar flexion, inversion. Hold here, don't let me move you. Hold, hold, hold. Good, and we can see the posterior tibialis coming in through here. Nice thick tendon, and follow that down to the navicular. Okay, and then you can relax. There, it popped out. Do that one more time for me. Hold here. Here it says posterior tibialis right in through here. That nice thick tendon, follow that down to his navicular, and then relax. And you can also go from the medial side of the first metatarsal and move down again to that first large bony prominence that you feel. But again, make sure that bony prominence connects directly to the posterior tibialis, so there's no other anomalies that you might be palpating in between. Once you get to the navicular, again, confirm with resisted plantar flexion inversion to confirm that you're on the right structure. So that was all the structures we have. If you need to look them up, you can go onto the list on your objectives. But for now, we've got the anterior talofibular ligament, calcaneofibular ligament. We did the sinus tarsi. We did the base of the fifth. We did the neck of the talus. We did the dorsal pedis artery. And then we did the navicular. So make sure you feel confident with that for lab. And we've got lots more on Monday. See you then.